Question 23b was broken into two parts, B1 and B2. And B1 was described 3 advantages of the public health insurance, which we were talking about Medicare, and is worth 3 marks. And 23b2 was described 3 advantages of private health insurance, again worth 3 marks. So it's a good question to be able to break a 6-mark question into 2 sectors, both worth 3 marks. So we're aiming to get 6 marks here, obviously, and we'll look at how we could have got 3 marks for each question. The syllabus areas that we're looking at: health insurance, Medicare and private. Describe the advantages and disadvantages of Medicare and private health insurance costs, choice, ancillary benefits. So that's the dot point. Comes from healthcare in Australia, specifically, as I said, looking at Medicare and private health insurance, and it tells us there that we need to learn to describe the advantages and disadvantages. So that's a very explicit part of our syllabus, and something we need to be aware of to be able to do well in this course. Describe, that's our key term. We're providing characteristics and features of. So we need to do more than simply list or outline, but we need to be able to give some substance to be able to talk about and give some characteristics and features of the advantages. So as well as listing the advantages of both aspects of private and of public health insurance, we probably need to show why they are advantages. So in saying that, let's have a look at a couple of responses that were able to do that. This particular response, the interesting part of this response was that they did it mixed up the areas. It was clear to myself that they'd done that, and if we see up here, they've crossed that out. So if you make a mistake in your answers, that's okay. Just make sure it's clear for the marker that what you've done with the alteration, if you have to do that. Obviously don't do that unless you have to, but if you do make a mistake and have to alter your response because you've changed something or you've got something out of order, then make it clear. And that was done in this case. In terms of the advantages of public health insurance, if you were able to discuss it's free treatment as a public patient in public hospitals, subsidised treatment by medical practitioners, for example GPs, the increased equity and access to health services for people of low socioeconomic status, broad range of high quality healthcare provided, including emergency healthcare, and availability of bulk billing. If you were able to discuss any of those in respect to Medicare or public health insurance, then you were able to get 3 marks there. In terms of discuss, what I mean by that is list them and show a bit more than that. Just say make a list and show why that's an advantage. If we have a look at another response, we can see that this particular response is with regard to private health insurance. Now, I guess in terms of the private health insurance, they're talking some of the things that they would have discussed in this answer would have choice of hospital services, health cover while overseas, private rooms in hospital where available, subsidised ancillary care. What we mean by ancillary is the add-ons, so the extras that you would require, for example, physiotherapy and chiropractic care. That means if an advantage of private health insurance would be a shorter waiting list for surgery. Those have all been advantages for the individual, but if we look at it in terms of the public system, what that means for the public, and again, advantages there, surely decreased demand on public facilities, that would be a big advantage for the general Australian population. And I guess the other thing would be general peace of mind. So in this response, they've looked at many services or entitlements, so a range of areas there that they're able to get at a subsidised rate as a result of their private health insurance premiums. They've talked about overseas. Most people were able to discuss shorter waiting lists and availability to get into your required service much quicker. If we have a look at another response here. Same response. But that was the major gist of what people were talking about in these two areas. Problems that people may have encountered didn't show how they were advantaged. Maybe didn't get the 3 advantages that you were required to do. They were the biggest problems that people had in this particular response.